Hello, I'm Dr. Prasanth Pillai. This time we've made a video on root canal treatment. Many of my patients requested me that I make a video on root canal treatment, even though I'm a maxillofacial surgeon. They wanted me to make a video, and therefore I decided to make a video. I just wanted to give you an overview on what root canal treatment is. So now in this particular image you can see this is the structure of the tooth. You can see the outermost layer as the enamel, the second layer is the dentine, and the core of the tooth is the pulp. The pulp is what makes the tooth living, and this is the photograph of an extracted tooth where the root has been separated, and you can see the pulp here. This is the pulp, and this is what makes the tooth living. So this is the structure of the tooth, the cross section of the tooth, and you can see the pulp coming in, and you can see the dentine, and this is the enamel, which is the living portion of the tooth. This is the structure of the molar teeth and the premolar tooth here. This is the molar tooth and this is the premolar. You can see the neurovascular bundle, which is the living, the nerve and the blood vessel complex, which runs below in the jaw. And from the neurovascular bundle, you can see the pulp coming into the root structure, and it comes and forms a plexus here. So this is how it works. And this is the structure of the canine root canal, and this is the structure of the premolar root canal. And here you can see the structure of the infected tooth, and on this side you see an abscess, and on this side you see the inflamed ligament. So this is what happens with a root canal infection. Either the ligament is inflamed or you develop an abscess. In advanced cases you develop an abscess, and this is what we normally do. In such a situation you are left with two options. One is to remove the tooth, or the other is to do a root canal. So in a root canal, what do? We use a special instrument called root canal file. First we use an instrument called a broach to remove all the pulpal contents, and then we clean and widen the canal with the help of root canal files, and then finally we drain the abscess and we fill this up with a root canal sealer, with a root canal filling. So you can see the sequence of root canal treatment. In this image you see how the normal structure of the tooth is, and here you see the pulp is inflamed, and later the pulpal inflammation spreads to the root tip, and then it comes out as an abscess where there is a bulge here. And this is what a root canal treatment is. We remove the root canal pulp completely, and then we fill this up with a inert material called gutta percha, which seals the root canals completely, and then we give a crown on top, because unless we give a crown, the tooth is likely to break. So these are the various steps of root canal treatment right from beginning to the end. And this is a small video showing the way we do a root canal procedure.
Tooth decay, when left untreated, can progress to the innermost portion of the tooth, called the pulp, and may also cause an abscess to form at the root of the tooth. Endodontic treatment, which is more commonly known as root canal treatment, is required when decay has reached this stage. During this procedure, all decay is removed using a drill, and the upper portion of the pulp is also removed, giving access to the root canal. Filing of the inside of the tooth helps to remove any remaining infected pulp, and the root canal system is cleaned. A material called gutta percha is used to fill and tightly seal the root canal system. This material is bioinert, so it does not react with the body. It is inserted, impacted, and cut to the desired shape. The remainder of the tooth is restored temporarily with a composite material which is set using a dental curing light. If the tooth shows no further signs of infection,
in certain situations what happens, you need to have a post fitted inside the root canal to reinforce the tooth. So here is a short video on that.
We use a post and core to replace the missing portion of a severely broken down tooth after root canal therapy and prior to placing a crown. The post, often made of metal or fiber-reinforced resin, is used to anchor a core, which is also called a build-up. First, we prepare a space for the post in one of the root canals. We try in the post and then cement or bond it in place. Next, we place the new core material on the tooth. Lastly, we shape the material to accept the crown. Placing a post and core in a tooth prior to a crown strengthens the tooth and provides better retention for the crown. A post and core is an important step for saving teeth that may have been damaged by fracture.
So that is what a post and core is. I thought it was important that I share that with you. And now please remember, very often there are situations where we have multiple canals coming in into the roots, and in all these situations you can develop reinfection. In spite of doing a perfect root canal, you can still have a reinfection. So that's something which you should remember. Now this is a typical picture of a molar root canal case. As you can see, we have exposed the pulp here from the surface, and we've exposed the 3 canals. You can see the 3 canals, and we've negotiated into the canal with certain root canal instruments, and we've made this X-ray. And this is the root canal filling, which you can see with Gattaparcha, and this is the final temporary filling which we've provided on top. And this is the pre-treatment X-ray, and that is a post-treatment X-ray. You can see how the infection has been eliminated at the root tip, and this is what we call furcation involvement, where the junction of the root has been affected by the caries, by the decay. And in such a situation, we don't do root canals. We prefer to extract, because the tooth does not really survive. Now, laser assisted root canal treatment is lasers are employed to do a lot more efficient root canals, because what happens, the laser beam goes and sterilizes the root canal system, so that we are able to clear up even the accessory canals, which is very, very important in success of the root canal. So there are situations where we have to use lasers to ensure that the root canal is disinfected in a proper way before we do the sealing. And there are also situations where you need microscopic endodontics, where they use microscopes to identify the canals and seal the canals in a proper way, to ensure that the root canals are done properly without failures. This picture was shared by a friend of mine, in which you can see all the teeth have been root canal treated. Let us hope patients don't end up in such situations, because you can imagine the amount of treatment this particular patient has undergone. And this is the image of a patient of mine who reported to our center recently. You can see that there have been multiple root canals done, but they've all been improperly done, and she has developed infections around the root tips. You can see the infections around the root tips, and now we are taking her up for a complete revision, that is repetition of the root canal. Now this root canal was done more than 10 years ago, somewhere near Bombay, but you see the situation is very bad now, and she's experiencing a lot of pain here, and we are going to repeat the root canals now. This picture shows a non-vital incisor tooth. Non-vital means it is dead, and you can see the discoloration of the crown, and this has happened because of the infected contents leaching out and permeating into the enamel, causing the discoloration. And in such situations, we have to do a root canal treatment and then put a crown. So this is what we do. And this X-ray is that of a wide apex, where the root canal is a is very wide. This happens always in children. This is the incisor of a child where the root canal is not fully formed, and therefore the instrument is here, but it has gone beyond the apex because there is no constriction, as you see here. Normally the instrument stops at the constriction, but here, because of the wide apex, there is no constriction, and the instrument tends to go into the tissue beyond the apex. So in such situations, a pediatric dentist has to treat the patient and address this problem, and then a proper sealing should be done maybe after the patient has matured fully and the tooth, the root formation is complete. Now, failures in root canal treatment, about 5% of root canal cases show failures because of multiple reasons. Very often, as I was mentioning earlier, the root canal system can have branches, and these branches may not be accessible, because of which they develop failure. And the patient can also have pulp stones inside the dental pulp, which can again create failures. And the multiple branchings cannot be identified, and very often, now this root canal has been done properly, but in spite of the branching, but there are situations where you cannot identify the branches, and in such situations you're unable to complete the root canal treatment and in a proper way, and then that ends up in a failure. These are cross sections of the root canals in different molar teeth, as you can see here. They have a very complex system inside the root, and this can always create problems as far as restoration is concerned. So you've got to be aware of this. And these are all depictions of the root canal system inside the root, as you can see here. And here you can see there is an obstruction inside the tooth, and the instrument is unable to go into the pulp because there is a obstruction created by a pulp stone. And this is basically a calcification, and such calcifications can always complicate root canal treatment. And in this situation, the root canal is reasonably well done. In spite of that, there is an infection here, possibly because there is an accessory canal or some other problem which could not be identified from this two-dimensional image. You can see, if you look at the root canals, they are all reasonably well done, but in spite of that, you can still see infection around the root tip. Now, if a tooth is not treated properly by a crown after the root canal, this is what can happen. You can have a fracture of the tooth. You can see the lingual cusp of the tooth is fractured and it is separating. This happens because of the not providing a crown on the tooth at the right point of time after the root canal. Now, a dental cyst, and abscess, and a granuloma. So you can see this is a dental abscess which is tunneled outside because the infection has tracked outside into the gum, and you can see the periapical lesion, the lesion around the root tip. And here you can see that the pus has tracked out into the cheek, and this is we'll have to do a procedure called IND, that is incision and drainage, to remove the pus from this particular area before we treat the patient properly. Now, this is you can see how the root canal treatment has been done and how the infection is resolved in this case. And this is a situation where you can see the root apex has been sectioned, and this is what we call apicectomy. Here you can see there is a cystic lesion at the root tip, and in such situations we have to remove the cyst through a surgery before we do the proper root canal treatment. And apicectomy is a procedure where we section the root tip through a surgical approach, and then we fill the root canal separately, as you can see here. And this is another depiction of apicectomy procedure, as you can see here. And this is another depiction of post and core build-up, how we insert a post to build up a tooth which is gone, which is practically deficient in order to put a crown. So once the post is inserted, this allows us to create an additional coronal portion to help build up a crown. Thank you very much. I hope you liked the video. If you've liked the video, please share this with your friends and also press the like button as well as the bell button. Thank you.